Welcome back. We're now going to get into Chapter 9, Facial Massage. Their learning objectives for this chapter is to explain the importance of facial massage as an aesthetic service, describe the benefits of massage, discuss facial massage contraindications, describe the 5 types of massage movements used by estheticians, explain how to incorporate massage during the facial treatment, and perform a basic facial massage. Massage is a manual or a mechanical manipulation achieved by rubbing, kneading, or other methods that stimulate metabolism and circulation. So manipulation of the muscle is really the definition. And a thorough knowledge of muscles, nerves, connective tissues, and blood vessels is vital to performing a massage correctly. And a massage has many mental and very many physical benefits as well. Estheticians should then have a thorough understanding of facial massage because learning and practicing your technique is going to allow you to provide your clients with superior results and create a more loyal clientele. Also, it just really feels good. You should be able to also explain the physiological and psychological benefits of facial massage to the client. And knowing the proper techniques and contraindications for facial massage is important for client safety. And overall, massage is a foundational service that enhances the product effectiveness. So facial massage is providing relaxation. It increases circulation to assist with oxygenating the skin and bringing vital nutrients to the epidermis since it is increasing circulation, so blood flow to the surface of the skin. And it's also then assisting in the removal of waste since it does help transport lymph fluid and move lymph around. Question number 1 is, what is the definition of massage? There's a variety of techniques that you can use to give the best massage for each client's individual needs, but it's good to be mindful of the results that you're trying to achieve and of the client's overall comfort. So some of the benefits of facial massage is that it relaxes the clients, especially the facial muscles. It stimulates blood and lymph circulation. It improves overall metabolism and activates sluggish skin. It helps with muscle tone, and it helps cleanse the skin of impurities and then also softens sebum. Massage also can help slough off dead skin cells, acting as a form of exfoliation. It reduces puffiness and sinus congestion. It helps with product absorption. It relieves muscle tension and pain. And then it overall provides a sense of well-being. Question number 2 is, what are at least 5 benefits of massage? There are certain health problems and skin conditions that would contraindicate a massage. So before performing a service, and that includes any facial massage or facial in general, you need to consult with the client's intake form. During the consultation, you should acknowledge and discuss any medical conditions that could be a contraindication. And if your client expresses concerns about having a facial massage or has a specific medical condition, you should advise them to speak to their physician before having the service. And then you could also alter your service if you need to. Facial massage contraindications and product allergies are going to be the same as facial contraindications that were discussed in Chapter 8. So you can look at those again if you need a refresher. But specific contraindications are going to include contagious diseases, inflamed acne, so you don't want to massage any area that has pustular breakouts, sunburn, windburn, irritation, or severe redness. In that case, for example, if someone has irritation or severe redness, you would use cold compresses, or you could even go over with the cooling globes to kind of help calm that redness down. Sensitive skin or severely sensitized skin by the use of acne drugs or other topical peeling agents. And then in that case, you could also use the cool globes, but maybe not have them super, super cold. And even maybe the jade roller. That would be a little bit more calming too for that. More contraindications include open lesions, cuts, sores, or abrasions, of course, other skin disorders, severe or uncontrolled hypertension, and uncontrolled diabetes. And traditionally it was contraindicated, but it's now acceptable for many clients who have high blood pressure or hypertension, diabetes, cancer, or a circulatory condition to have a facial massage. Although those that are receiving a cancer treatment should not receive massage unless it is from an oncology trained esthetician, and the movement of the lymph through the body could cause complications for the client. And estheticians' massage services are commonly limited to a certain area of the body, so like the face, the neck, shoulders, and décolleté, depending on the state's scope of practice. Therapeutic massage, so deep tissue and manual lymphatic drainage, should only be performed by a licensed massage therapist who specifically specialize in those areas. And many body treatments, such as back facials or wraps, are performed by the esthetician, kind of without the massage, but only the application of the products typically. But I really think it's okay if you do some massage techniques. Getting into the types of massage movements, we have effleurage first, which is a soft, continuous stroking movement applied with the fingers and palms in a slow, rhythmic manner. The fingers are also used on smaller surfaces like the forehead and the face, while the palms are going to be used on larger surfaces like the shoulders. It's often used to begin and end sessions, and it's used on the forehead, face, scalp, shoulders, neck, chest, arms, and hands. And it's the most important of the movements and should be used in conjunction with other types of massage. I would say it's a very good transitional of movement and just a general movement to do even all the time if you wanted to. It's also good to note that once you begin effleurage, your hands should not leave the face or the body part that's being massaged, just for flow sake. To position your fingers, you can slightly curve the fingers with just the cushions of the fingertip touching the skin. You should not use the ends of your fingertip because they can't control the pressure and can scratch the client. To position your palm, you should hold the whole hand loosely and keep the wrist and fingers flexible. You can curve the finger to conform to the shape of the massaged area as well. Petrissage is a rhythmic compression technique that includes kneading, squeezing, and pinching, and this affects the deeper muscle tissue of the face, and it stimulates the underlying tissue. Petrissage itself is very stimulating for circulation, which can also improve the skin's appearance and tone, and it's performed typically more on the fleshier parts of the face, the shoulders, and then the arms. And what you do for petrissage is that the skin is grasped between the thumb and the forefinger and then squeezed, rolled, or pinched with a light, firm pressure. Tapotement is also known as percussion or a piano movement. It's a percussive stroke which the fingertips strike the skin in rapid succession or fast tapping movements. It does improve circulation by stimulating the diffusion of the capillary network, and this will help nourish the skin by releasing nutrients and purifies the system by releasing carbon dioxide and other waste material. And it's very good for toning, and it's beneficial for sluggish skin. And this is going to be the most stimulating of the movements and should be applied carefully. Friction is an invigorating rubbing technique that stimulates the circulation and glandular activity of the skin. It can be performed in a circular manner or a crisscross manner, and pressure is maintained throughout the massage movement. And you would use circular friction movements on the scalp, arms, and hands, and lighter movements on the face and the neck. Vibration is a rapid shaking movement which the esthetician typically uses their body and shoulders, not just their fingertips, to create the movement. The balls of the fingertips are pressed firmly onto a plane of application, while rapid muscular contractions in the arms create the movement. And this is very highly stimulating and should only be used sparingly and for only a few seconds in any one spot. There are different types of massage that are also based on body structure and energy within the body. Most are based on classical or Swedish massage movements, and in addition, advanced massage techniques that stimulate and detoxify the body do require additional training. Acupressure is a massage technique derived from Chinese medicine. It consists of applying pressure to specific points of the face and the body, so acupressure points, and these release muscle tension, restore balance, and stimulate qi, which is life force or energy in Chinese. Shiatsu is a form of acupressure. This is the Japanese technique of using acupressure massage points to relax and balance the body. There are many motor points on the face and neck that are acupressure points, and the standard pressure point technique is to pause briefly for a few seconds over the motor points using light pressure, and it's also used on the scalp. Pressure point massage is similar to acupressure. On each point, there is a movement that is repeated 3 to 6 times with 3 to 6 second pauses on each point. You would move to point from the top to the bottom of the face using light inward pressure at each point and lifting to slide to the next point. Aromatherapy uses essential oils mixed with an emulsion or an oil, and that is applied to the skin during massage movements. Oils promote mental relaxation and treat skin in numerous ways depending on the essential oil that you're using. Manual lymph drainage, or MLD, or manual lymphatic drainage, uses gentle rhythmic pressure on the lymphatic system to detoxify and remove waste materials more quickly. It reduces swelling, and it's used before and after surgery, and it's using a very light touch. Question 3 is lift the 5 main massage types of basic massage movements, and then briefly describe each of the massage movements. Question number 4 is what is manual lymphatic drainage or manual lymph drainage? When the massage is performed in the facial, it's going to depend on many factors. A facial massage routine will change depending on the training and then the protocols established by the facility or the product manufacturer. The facial massage is performed for approximately 10 to 20 minutes during a facial. Some treatments incorporate more massage and others don't include massage at all. And techniques will also depend on the client's skin analysis and then your goal. You can learn the technical skills. So a professional facial massage is one of the major difference between a professional treatment in a spa and a home care regimen. The key is that the massage is performed correctly. Some important tips and techniques to know. When performing massage, hand movements need to flow and be consistent, gliding easily from one area to the next. Mental focus is important when giving a massage, and it's helpful to explain to your clients what you're trying to achieve with your facial massage techniques. You should communicate with your clients and adjust your touch according to their preferences. You should educate your clients so they understand that excessive or deep massage is too rough for facial skin. Massage pressure, massage type, and the duration will vary according to their skin type. An even tempo or rhythmic flow is going to promote more relaxation. Massage should be started on the chin, décolleté, or the forehead. You should not remove your hands once you have made contact with the skin. You should always massage from muscle insertion to muscle origin of the muscle to avoid damage to the muscular tissues. And massage movements are usually performed upward and outward of the face and the neck. With all of this massage, you really want to maintain your hand mobility, and estheticians' hands should be flexible. They should be soft with short filed nails. Hand mobility is important in maintaining a smooth rhythm and regulating the massage pressure. The correct balance of synchronization and pressure comes with practice and just being attentive. Hand exercises can help strengthen the hands and prevent repetitive motion problems. Estheticians are susceptible to problems because of the repetitive movement, muscle and tendon strain, and fatigue due to improper or poor posture. When you choose a massage product, you want to be sure that it provides a smooth glide and that the formula works with the client's skin type. A serum or a gel-based massage product will provide gentle friction and the ideal glide to leave all skin types relaxed and hydrated. Rich herbal cream-based products provide the ideal glide to perform facial massages for drier skin types, while the scents of the herbal extracts can be calming and soothing. But you should be sure to check your client's intake form for all of their allergies first. Talking can eliminate the relaxation therapy of the massage. So if the client is talking, you can invite them to relax and enjoy the massage, and you shouldn't try to continue the conversation, although it might be hard. You should speak in a quiet voice and only when necessary during the facial. You should put all of the distractions aside during a service, and an esthetician's mood and mental disposition can affect the service and the client. Many estheticians close their eyes and take a few deep breaths before they work on a client. You should choose your starting point. So starting points can vary. Massage may be started on the chin, the décolleté, or the forehead. And different massage movements may be used on various parts of the face, chest, and shoulders, and then repeated 3 to 6 times before moving on to the next one. You can then slide your hands back to the starting point to repeat the movements. Massage movements are designed for a smooth and graceful flow from one movement to another. To keep the relaxing flow and connection, you shouldn't remove your hands from the client once you have made contact with the skin to begin the facial massage. Maintaining contact gives your client a sense of physical continuity that is very soothing and calming. If you do need to remove your hands from the client, you should slow down the movements and replace them with a gentle feather-like movement that is often called feathering. And then when you come back to the face, gently make contact on the side of the face or the top of the head to avoid startling the client. And to administer a complete and effective facial massage, you must have a thorough knowledge of the facial muscles and underlying skeletal structure. So knowing the correct names of muscles and bones will aid you in your aesthetics training and career. Massage from insertion to origin. So you should always massage from muscle insertion to the origin, and this will prevent breaking down tissue and potentially causing premature aging. The insertion is the portion of the muscle at the more movable attachment site, and then the origin is the portion of the muscle that is at the fixed attachment site. To avoid undue pressure and stress, it's important to massage the muscles using outward strokes, because inward strokes can weaken the skin and cause premature folds and wrinkles. And with outward strokes, the skin is not being pulled and then muscles aren't going to be weakened. It's also important to remember to adjust your pressure as necessary. You should check in with the client about their comfort, and remember that the facial massage should be lighter than a body massage, and you can let the client know this and let them know that the skin on the face has to be treated more carefully. And you can sharpen your professionalism. So if a client seems dissatisfied with the facial treatment, it could be due to a number of reasons, but some things that you could maybe think about are an offensive breath or body odor, rough, cold hands or ragged nails that might have scratched the client's skin, allowing cream or other facial products to get into the client's eyes, mouth, nostrils, or hairline, applying too much massage oil or cream, using towels that are either too hot or too cold, talking too much, manipulating the skin roughly or in the wrong direction, being disorganized and interrupting the facial to get supplies, having sloppy product application or movements, and noise or distractions during the service. Question number 5 is, in what direction do you massage on the muscles? Massage is typically the most relaxing part of the facial, and it has many benefits. Various massage techniques can be incorporated into facial treatments. Appropriate massage movements are based on the anatomy of the facial structure, nerves, and the muscles, which you can see here on the screen. Using proper techniques is important. It's also necessary to know the contraindications for massage. And now that we've covered all of that, you can look at pages 398 to 408 on the textbook, and that will show you procedure 9.1, which is a basic facial massage. So to recap our learning objectives, we explained the importance of facial massage as an aesthetic service, described the benefits of massage, discussed facial massage contraindications, described the 5 types of massage movements used by estheticians, explained how to incorporate massage during a facial treatment, and perform a basic facial massage. And that is the end of our Chapter 9 facial massage lecture. See you guys next time.